KBTC, a viewer-supported community service of Bates Technical College.
From KBTC Public Television Studios in Tacoma, Washington, welcome to the Steve on the Street podcast. A closer look behind the headlines as public policy and current affairs impact the real lives of real people.
Welcome to the Steve on the Street podcast, produced by KBTC's Northwest Now. I am photojournalist and reporter Steve Kickens, hosting this latest episode, and today we're talking back to school for kids across Western Washington, and determining and guiding steps to monitor and enhance youth mental health is the Washington Healthy Youth Survey. It's a collaboration with state, local, and tribal education and public health agencies. We remember the COVID-19 pandemic paused the 2020 report. The latest release happened in 2021, and officials are now gearing up to conduct the 2023 survey. Today we're speaking with the State Department of Health, Dr. Maayan Simkis. So you're the expert on the Healthy Youth Survey.
I am one of the experts. There are many, many folks who work to make this survey happen.
Got it. I understand. Yeah, there can't be just one.
There can't be just one. I do have specific hats I wear, though.
Yeah. Well, it looks complicated in terms of the number of topics it broaches and the number of age groups that it approaches. So it's really wide ranging. Maybe you can help our viewers understand kind of the scope of the survey and the kind of broad range that it hopes to tackle.
Absolutely. So the Healthy Youth Survey is comprised of questions that have been asked of students in Washington since the early 80s. And in the early 2000s, the survey was formed as a partnership between 4 state agencies. So we have the Washington State Department of Health, the Healthcare Authority, Office of Superintendent of Public Instruction, and the Liquor and Cannabis Board. And we work together to every 2 years produce a survey that is administered in schools across the state. It is directed primarily for students in 6th, 8th, 10th, and 12th grade, so about 12 to 18 years old. And it covers a huge range of topics, everything from basic demographics and age, race, ethnicity, for example, to things like how they're doing in school. Do they do school activities? What about substance use, mental health? Do they like to do sports after school? How do they feel about their future? So we really want to understand youth from their own perspective. And it is the most robust source of information that we have about youth by youth in the whole state.
Are you finding that youth out of all of those ages don't really have a problem telling you exactly how they feel and exactly what they're getting into?
Students love to share information and they love to tell us about how they're doing. We have done some focus groups with youth. We've invited them to be part of the process for revising and testing questions. And anytime we have students engage with us, they're fascinated, first of all. They want to understand when they give us information, where's it going? How's it being used to help them? How do we take this information and turn it into programs and resources for youth? So there's a lot of eagerness, to be honest, to tell us about what their experiences are. And we love getting to hear from youth about how much they not only appreciate the project, but that they get to go back and use some of the information that we make public online.
Fascinating. Let me ask you about the last handful of years, just because everyone got thrown for a loop with this pandemic and all the subsequent actions and reactions to it. So how did that kind of change in terms of response and the number of students that participated? And what are some of the findings that may have changed in that kind of pocket of time compared to this latest survey, which I believe was 21?
Yes, so terrific question. Just background for you, I'm turning off my interviewee kind of mode for a second. We did the survey in the even years. In 2020, we postponed it till 2021. The next survey is 23.
Yeah.
So it comes this fall, just,
Right.
So to your question, The COVID pandemic really had an impact on the way that we do the survey. So historically, we've done the survey in even years, going back to 2002. In 2020, we said, you know what, a lot of students aren't in the classroom. We need to figure out how to make this work. So our agencies got together with our planning committee. We looked at the technology available with our contractor, and we ended up moving to a fully online survey with the exception of a small number of places that still wanted paper. And we postponed the survey to 2021. When we did the survey in 2021, we did still see a reduction in the number of students who took the survey. So in 2018, there were around 235,000 students across the state who did the survey. And in 2021, we had about 208,000 who took the survey. So there was a bit of a drop, but frankly, that wasn't surprising. And we were really pleased with the turnout. It was really terrific to know that schools were able to administer the survey in an incredibly difficult time. Schools were being asked to do the unimaginable. Students were facing absolutely wild experiences, unprecedented, as everyone's heard that word quite a lot over the past several years. But it allowed us as a survey team to evolve and modernize our approaches. And you asked a little bit about the results. What did we see in the findings? So data from 2021 are a little complicated to interpret, partially because we don't really know what some of the changes we saw mean. So for example, we saw a drop in substance use across the board: alcohol, tobacco, vaping, cannabis. And we don't know if that's because parents were with their kids more at home, if kids just weren't attending social gatherings, so they weren't having exposure, or maybe there was actually a reduction because youth heard about a respiratory illness and didn't want to use, respiratory inhalants, cigarettes, vaping, etc. We don't actually have an answer with just 1 year of data. So what we're looking to do now in 2023, when we administer the survey, and then in future years, is track that trend. It started to drop pretty severely in 2021. We want to know, is it going to continue to drop? Is it going to level off, or might it start going back up and leveling out to where we saw it pre-COVID? And we really don't know until we get more data. So that's part of why the survey is evolving over time. It's helping us to understand what we need to in any particular moment. Just as we change our methodology, we also revise our questions.
I'm speaking from a layman, but what struck me as rather surprising were the number of students who were honest about not feeling they had a connection to an adult that they could lean on, that they could talk to. How has that attitude shifted in the past number of surveys?
It's a terrific question. I have the trend data that I can pull up for you and we can look at it, but I'll just share some of those numbers first, if that's okay, so
Please.
Folks can get an understanding. What we saw in 2021 is that roughly 2/3 of students said they felt they had an adult they could turn to for help if they needed it. Somebody that they could go to if they felt sad or hopeless for some kind of support. 2/3 isn't terrible, but we saw that number dropped for certain youth. For example, LGBTQ plus youth, youth with disabilities, Black and Indigenous youth, all reported less frequently that they had an adult to turn to. And it's disturbing when we see patterns of youth who aren't able to turn to an adult or don't feel that they can, because we also know if you don't have an adult to turn to, you're about half as likely to report, I said that backwards. Let me correct that. We know that youth who have an adult to turn to or feel they do are half as likely to report depressive symptoms than those who say they don't have someone to turn to. And students who have an adult to turn to are also less likely to report suicidal ideation. We know that relationship, that social connection at school, at home, and in their community is incredibly important to youth well-being over time. During COVID, we saw a variety of changes in this. We saw some youth saying they had less connection at school, which would make sense if they weren't in person. Some were able to find more connection online. Some were able to find connection with community, and some faced more challenges because of distancing, because of the closure of some of those social spaces that they were used to. Our hope is that as we emerge from some of the social isolation of the earlier parts of the pandemic, youth will find more ways to connect, and that this protective factor of connection will really help benefit youth over time.
It must be troubling to hear that kind of response from the segments of students who are part of a community who might already be feeling left out and maybe marginalized and perhaps victimized. How does that change the approach and questions for the next survey?
What a terrific question, Steve. We do our best with the Healthy Youth Survey to follow the patterns that youth are sharing with us. When we see that youth are struggling in a particular area, or if a community comes to us and says, here's a topic we're really worried about, we will work on identifying ways to add questions to the survey or modify what we have to explore the problem further. And I'll give you an example. Before the 2021 survey, we had a number of community groups raise concerns around problematic internet use. They were specifically concerned about youth exposure to the internet, to social media, and how much time they were spending online. What are the impacts of that on youth? So we started to hear this. We recognized it was a problem. A proposal was submitted. And so we rolled up our sleeves and we got to work, and we identified a tool called the Prius around problematic and risky internet use. It was developed by Dr. Megan Moore at the University of Wisconsin-Madison. And Dr. Moore's team created a 3-item version of this tool, 3 questions that help screen and identify youth who are at risk for problematic internet use. Now, in a clinical setting, we might use a scale like this and then have a follow-up with a counselor. On a survey like the Healthy Youth Survey, it's totally anonymous. We can't follow up with students. We don't get to step in and offer services. Instead, we use something like this to understand the trend. What's happening among youth? Which youth are most at risk? And how overall do we provide services that reach that population? So we added this new 3-item tool on problematic internet use to the survey, and boy, did we find a lot. We found that approximately 1 in 5, that's 20% of 10th graders, were at risk for problematic internet use in 2021, 1 in 5. Now, what does that mean? Problematic internet use includes feeling anxious or withdrawal when you're not able to connect to social media or internet, or feeling a lack of motivation to do anything due to internet use. So if you're feeling anxiety or withdrawal or a lack of motivation because of your internet use, that seems like a really challenging way to be a kid and try to go to school and participate in activities and be part of your family. But not only that, we know that 10th graders who reported problematic internet use were also 2 times more likely to report depressive symptoms and 2.3 times more likely to report suicidal ideation or considering suicide. We know that problematic internet use is higher among populations that are already set up structurally to be more disadvantaged, that already faced more barriers to well-being, like LGBTQ+ youth, youth with disabilities. And we know for some of these populations, social media can actually provide a positive benefit. It can provide community. It can provide support and social connection when sometimes you can't find it in your physical geography, what's around you. And there are always risks. The risks and benefits are challenging. And I think we're trying to answer the question, although this survey is likely not going to be able to do it on its own, how much is too much when it comes to social media, and what kind of social media interaction is okay and what kind might be more problematic?
Maybe if we take just a step back, I just have a couple more questions for you. And some of the other questions and responses that struck me as concerning were the number of young folks talking about feeling anxious and depressed. Now, it's been a long time since I was a child. I had those days, but the numbers that they described in the 21 survey, frankly, were shocking to me.
I agree. In 2021, we had a lot of youth in our state reporting anxiety. And we found that among 10th graders, and 10th graders are often the group that we use as a reference, So we found that among 10th graders in 2021, almost 70% of youth said that they were feeling some level of anxiety in their day-to-day lives. And we saw that number was even higher among youth who are facing additional struggles and additional barriers towards well-being, like LGBTQ plus youth, for example, where it was closer to 90%. And it's very distressing to know that we had youth during that time and continuing onward facing so much anxiety. Some of it obviously was contextual. Some of it might have been because of the pandemic or a lack of access to school resources, uncertainty. In fact, on the survey, we included a few questions with our last cycle about worries and fears related to COVID. Fear of not having enough food to eat, or a parent losing their job, or not having stable housing. And we were able to see that students really were worried about their experiences. And what broke my heart was that sixth graders often were reflecting more anxiety and fear than even some of their older peers.
Wow. So since the latest 23 survey comes, I think you mentioned this fall, what is the state, what are the stakeholders who are putting this survey together? What do you anticipate in terms of response? Do you think you'll get the kind of turnout that we saw in, I think, 2018 and prior, or do you think we'll be a little bit lower and kind of see maybe an upward trajectory? And how might some of the new questions be posed to these youth coming from what they've already told us concerning the last few surveys?
Hey, there's a lot in that question. So let me start with the first part about
Sure.
the response rate. So we aren't sure what to expect in terms of the number of completed surveys we'll have this year. The decision to take the survey isn't necessarily at the student level. Schools and districts decide if they're going to administer the survey. Students can choose not to take it. Parents can opt their students out. Students can stop in the middle of the survey if they want to. It's unclear if we're going to see numbers bounce back to where they were pre-COVID. It's possible. It's also possible they'll be similar. And if there's a bit more of a drop off, I don't think we would be that surprised. We know that schools right now are facing a lot of assessment, a lot of surveying of their students, and they're still trying to deal with the changes in their student body. The fact that students may have areas that need a little bit more attention or require a different kind of environment in the classroom. And so we know that schools have a ton on their plates. It's hard to know, but registration is open for the Healthy Youth Survey 2023. Schools and districts can register their facilities online, and we are really eager to see folks participate. There is no cost to participate for schools and districts that choose to. The results are provided to them at no cost. And we always provide as much technical support as we can. Your second question, can you repeat that portion of that for me?
No, let's see. I think we covered just the first couple. I think the one that were that was outstanding was what kind of direction could some of the questions in the 23 survey go in terms of what you had heard in the past surveys?
So how might we change the questions, or
if that's even a reality, if that's how that goes?
Okay. Trying to think the right way to kind of describe this without getting too in the weeds for you, Steve. So the survey goes through a 2-year cycle, and each cycle there is a window where we accept recommendations and requests for revisions. So after the 2021 survey, actually during it, we were already starting the process of revising the 23 survey. So we've started to make we made some modifications already to what's coming in the fall. We've adjusted the questions that were very focused on COVID. We've made some adjustments to make it easier for schools that are primarily online to also administer the survey. So we don't ask only about being in the school environment quite so much. We don't ask as much about being in person as much.
Sure, yeah.
So make it a little bit more flexible. We've also looked at using different survey platforms to make it more accessible. We've changed the languages. In fact, the survey will be offered in more languages this year than in prior years. And we have added new elements to make it more accessible online over recent years as well, for those who use screen readers, for example. So we're hopeful that the question revisions and recommendations we receive from community partners, from parents, from students, from colleagues in government, from legislators, will really help to address some of the emerging concerns with youth. It's also hard to know if we're going to catch everything that we need to. So for folks who are interested in learning more about the Healthy Youth Survey or contributing their thoughts and recommendations, our website has a survey that is available year-round where we are taking recommendations. We're always reviewing what we see. Our website is askhys.net. And we are super happy to hear what folks have to say because it really does help guide what we do each year.
So, thanks to the State Department of Health, and thank you to Dr. Maayan Simkes, and thank you for joining us on the Steve on the Street podcast.